thought we'd provide a primer on how AI is poised to impact DSOs and also the category generally. This will be a quick overview, but I think it'll help to level set around the kind of expectations that we should have of AI and what's coming down the pipe. And one of the topics that we're going to be talking about is consistency. So consistency of analysis, consistency of treatment planning. In my personal opinion, the thing that AI is going to lend to dentistry and medicine in general is a real heightened form of consistency, which is going to have truly dramatic impacts on the category. So the first question we might want to ask is, how inconsistent are we currently? Let's look at some data there. This is actually a study that Pearl ran. And in this study, we were looking at the question of carious lesions and the consistency of diagnosis across 9,000 radiographs and 3 practitioners. And if you look at the data here, what you find is that dentist 1 identified carious lesions 5.3% of the time, dentist 3 identified caries 16% of the time. And out of the 9,000 radiographs, the agreement across all 3 practitioners only 4.3%. And that's obviously a fairly striking finding. And also when you look at pathological analysis across various forms of radiographs, you find similar outcomes and in some cases more forms of disagreement. And that is at the heart of what we're talking about when we talk about consistency from analysis perspective. And moving on to another study, we worked with 138 practitioners. We gave them each an FMX set, and we asked them to come up with a treatment plan. The results here are also fairly striking. So just to pull out 2 of the teeth that were especially prone to feedback, we have 2-3 here, which was represented by the chart on the left. And about 40% of practitioners recommended a resin filling, but then you have a fairly equal distribution across all other treatment types, including no treatment at all. So the second largest component of that pie is a recommendation of no treatment. And you could see that it continues across the board. And if you look at tooth 19, you have an even more equal distribution of recommended treatments from these 138 practitioners. So you have a fairly even distribution across 4 different treatment types and a fairly equal distribution across the remaining 4. So findings confirm this underlying understanding that a lot of us in the industry have, that there is lack of consistency when it comes to diagnosis. So if we're talking about financial impact, let's take a look at how this actually backs out. On tooth 3, you have a good portion of practitioners recommending no treatment, so $0 in treatment cost to the patient. And you have about an equal amount recommending treatments between $1,000 and $3,000. So pretty wide variety there, and obviously variability in the in-between states. And if you look at tooth 19, perhaps even more striking here, these treatment plans went all the way up to over $5,000. And you have, again, a decent amount recommending no treatment. You have a little more than the folks recommending no treatment, recommending treatments between $2,000 and $5,000. And again, a bunch of variability in the middle. And I think these 2 studies really help to illustrate the thesis around consistency. I think there is a trust issue in dentistry, and on some level, you can't really blame patients, because when you look at the data and you see diagnoses across the board and you see treatment plans across the board, you can't really blame folks for wanting to get a second, third, and fourth opinion. And you can't really be surprised when the 4 opinions that you get back are totally variable, leaving a patient in a position where they're not entirely sure what to do. And obviously there's the paramount issue here, which is one of patient health and delivering the appropriate treatments to patients at the appropriate time. And from a DSO perspective, DSOs would really like to deliver very consistent and very accurate treatments. They want to have consistency in their business. They want to have trust from their patients. And if you're able to solve or largely solve the underlying consistency problem, then it's certainly our belief that that's largely achievable. So if we look at AI and what it could contribute here, it really is the most impactful possible solution to this question, an issue of consistency. So you have a tool that is trained across millions and millions of radiographs of all types, across thousands of practitioners. It's delivering a certain analysis of a radiograph, say, and that analysis is completely transparent. So when you look at the analysis, you understand why it made the decisions that it did. If you disagree with that, you're disagreeing with something very tangible, and you could improve from there. From an accuracy perspective, what you find if you look at the accuracy of the AI systems versus human practitioners, it routinely beats human practitioners across the board, across all pathologies. And you also have a system that is able to scale and operate at scale. So you can take millions of radiographs, process them in a couple minutes, and have that data to then interface with. So when you take this notion of computer vision, and computer vision is really the form of AI that we are talking about. It's the form of AI that at Pearl we specialize in. It's a branch of AI that is focused on teaching computers to see and interpret imagery in much the same way that humans do. When you marry that analysis with practice data, right, with information from the PMS, you really are arming yourself with a very powerful set of tools that are highly actionable and that you could use to improve your day-to-day service and also financial outcomes. So if we look at this question of clinical performance and what happens when you inject AI into that process, you are able to measure and analyze the accuracy of clinicians from a detection and treatment planning perspective. You're able to identify instances of overtreatment and undertreatment. You're able to deploy training tools. We've developed a number of training tools in conjunction with leading dental schools that you could actually deliver to practitioners so that they could continue to improve as it relates to their proficiency in reading radiographs and assigning treatment plans and actually track that performance over time. And this applies beyond just x-rays to all forms of imagery. Another thing that we do at Pearl is focus on intraoral scans. We're able to actually score the quality of preps for restorations and actually provide that information back to DSO management and back to practitioners so we can identify problematic areas, issue the appropriate training, and get folks to be better. It's not that practitioners are not able to get better at these things. They absolutely are. In many cases, very, very quickly. It is a function of having a feedback loop that is trustworthy, that is operating at scale so that folks are getting continuous feedback and therefore are able to improve. And that really is largely lacking today. And if we look at the perspective of revenue opportunities, you suddenly have the opportunity here. If you run a DSO of dozens or hundreds of offices, you're able to analyze the entirety of your patient populations at scale, at the pathological level. You could identify and surface missed opportunities and candidate opportunities for a wide array of treatment types. You can automatically organize and update patient data in the PMS. And also you can much better prepare for patient visits. So this could become part of the daily huddle, whereby you're able to plan for the day or the week and really come prepared to communicate with patients and affect great outcomes. And lastly, if you are an acquisitive DSO, this is an incredibly, incredibly powerful tool. You're able to look at sets of practices, identify, again, patient populations, revenue potential, historical diagnostic proficiency, presence of fraud, waste, and abuse. It really is a way to quantify the value of a set of dental practices in a way that was never before possible. So rather than taking sample sets of data and analyzing them and having lots and lots of conversations, you can do all of that, of course, but you can also look at the raw data and use that to quantify value. And we think that that is really another game-changing capability here.